Hello everyone and welcome back to the channel. If you are a parent of an autistic child, you are not alone if constipation has become a regular struggle in your home. To many families, this issue can be painful, frustrating, and honestly exhausting. Today, I want to reassure you of something important right from the start. Constipation in autism is very common and it is a biological causes. It is not about the child is lazy or something that your child is doing it on purpose. Chronic constipations can affect sleep, behavior, mood, learning. So treating it can be make a big difference in your child overall well-being. So in this video, we will talk about why constipation happens in autism and then focus on the biological treatment options, including diet, supplements, and medications, using approaches commonly recommended by healthcare professionals. Okay, let us start, parents. So first of all, why constipation is common in autism? What are the causes? First, let us talk about why this happens. As you all know, many autistic individuals have difference in how their guts and nervous system communicates. The intestine may move more slowly, which means stool stays in the body longer and become harder and difficult to pass. Some children also have reduced awareness of the body signal. Okay, they may not feel the urge to go until it is urgent or painful. Some or others may feel discomfort but not be able to explain it clearly because, as you know, most autistic child, they either have limited verbal or non-verbal. And there are also sensory factors. Bathroom can be overwhelming. The sounds, the smells, the lighting, or even the feeling of sitting on the toilet can be very uncomfortable. Diet plays a role too. Many autistic children have restricted food preference or sometimes very picky eater, which means that they consume low fibers or low fluid intakes. Yeah, we have come across autistic children do not take or doesn't want to take any liquid food or even plain water. And finally, some medication commonly prescribed for autism-related condition like ADHD, anxiety, or irritability can slow down the gut or worsen the constipation. So this is basically the side effect of the medications. All right. So now we we come to the treatment and management. Okay. So a biological treatment. What is biological treatment? So most doctors take step-by-step biological approach to constipation. First, they will think of how to soften the stool. As we mentioned just now, the stool stay longer and become harder in the body. All right. Second thing, help the intestine to move regularly. Okay, meaning that to increase the frequency of the bowel movement. Third, support the gut health, meaning that to make the good bacteria and the bad bacteria to maintain their balance. Okay. And lastly, the most important thing, consistency is the point. All right. Most of the parents give up halfway. Right. So let us be clear. Treatment of constipation takes time. 3 months, 6 months, sometimes 9 months. All right. So that's why parents have to be very consistent, be very patient. Okay. So let's walk through into each of the area of the treatment. First, supplement. Supplement is commonly being used for constipation. For example, magnesium is often one of the first supplement recommended. It helps to relax the muscle of the intestine and draw the water into the stool. All right, so making it the muscle movement become better, faster, and the stool becomes softened. And now the child can easily passing out the stool. Second, fiber. Fiber supplements can also help, especially if the diet is limited. This should always be started slow and pair with plenty of fruits or foods, right? So third one is probiotic. So probiotic may help to support gut movement and balance. It helps to repair the gut by maintenance the balance between the good and the bad bacteria. Okay, so diet strategy that support regular movement, that is very important, meaning that, okay, diet strategy, meaning that you have to reduce casein, you have to reduce gluten, you have to reduce processed food, you have to reduce those high inflammatory type of food, okay? So which also help to regulate the bowel movement, right? So healthy fat also another important diet. So fats help stimulate the digestive system and can make the stool easier to pass. This include food like olive oil or avocado or fatty fish. All right. So hydration, so I think hydration is incredibly important. Even a mild dehydration can worsen constipation. So small, consistent sip throughout the day are often easier than large amount at once, which most of the time the child refuse and dislike taking fluid intake. So now we come to medications. All right. So just now we walk you through the diet and the supplement. Now we come to medications. So I understand that a lot of parents actually they're worried about giving their child medication. However, rest assured, for short and medium period, you need medications to help your autistic children. Okay, so for example, osmotic laxative are considered first-line treatments. This works by pulling the water into the stool and are often safe for long-term use when guided by your healthcare provider. Okay, stimulant laxative is another type of laxative. Stimulant laxative are sometimes used for short-term, especially if the constipation is so severe, but they are usually not for long-term use. It should be used with proper medical supervision. All right. So the other one is another one is very safe. Stool softener may help if the stool are very hard. All right. So final thought for all the parents. So if you are dealing with constipation at home, please remember you are not failing. You are not alone. Your child is not misbehaving. This is the medical and biological issue, and the help is available. So I hope it helps. I will see you back in the next episode. Bye.